Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. Graft versus host disease, also known as GVHD, it's a life-threatening condition that can occur after a stem cell transplant or the transfer of stem cells from a donor, where the donated cells initiate an immune response and attack the transplant recipient's organs. Well, in 2022, Cincinnati Children's Hospital School Services and Cincinnati Children's Hospital MediaLab for Advanced Improvement Methods received a $100,000 Incyte Ingenuity Award in GVHD. This award-winning project aims to evaluate the academic performance of children and young adults with chronic GVHD. We're here to speak with Dr. Pooja Khandelwal this morning, member of the Division of Bone Marrow Transplant and Immune Deficiency at Cincinnati Children's Hospital Medical Center, and an associate professor at the University of Cincinnati Department of Pediatrics. She's going to discuss GVHD and her winning project. It's called Addressing the Gaps in Education for Children and Young Adults with Chronic GVHD. Welcome to Health Professional Radio, Dr. Pooja Khandelwal. Thank you for joining us this morning.
Thank you so much for having me, Neil.
Well, I mentioned your position and your award-winning project, of course. Tell us a little bit about yourself and briefly talk about your role there at Cincinnati Children's Hospital Medical Center.
Yes, I'm a pediatric bone marrow transplanter at Cincinnati Children's Hospital, and my clinical and research interest is in preventing acute and chronic graft versus host disease, which, as you mentioned, is one of the more significant complications in children who undergo a bone marrow transplant. Specifically, chronic graft versus host disease, it's a rare complication and also happens late. And what's important about this is it affects so many different organs in the body without any sort of clear way of predicting who is going to develop what specific organ involvement in chronic GVHD. But to give you some examples, it can affect the eyes and it can cause dry eye, or it can affect the lungs, affecting exercise capacity, or it can affect joints, causing contractures. I run a chronic graft versus host disease multidisciplinary clinic where I see these patients clinically.
So just to be clear, when we're talking about chronic GVHD, do most transplant recipients experience GVHD on some level and then it corrects itself, or there are effective treatments for it? But if it becomes chronic, then we have what we're dealing with now? Yeah.
So chronic GVHD happens late, and a lot of times if you have acute GVHD, you tend to also have chronic GVHD. And in general, there are treatments available for both acute and chronic GVHD. It is not something that goes away on its own.
Okay. Well, let's talk about your winning project, Addressing the Gaps in Education for Children and Young Adults with Chronic GVHD. What was the initial idea for this project?
So I actually came up with this idea based on patient experience. One of my patients with chronic GVHD, who was a very bright young lady and had enrolled in college and was interested in film studies, ultimately had to drop out because her chronic GVHD was so severe, and she was in the hospital for prolonged periods of time and had ocular or eye GVHD, which limited her ability to see the screen for long durations of time. And that made me just think that we need to do better and try and understand how we can help these patients and these young adults to be successful.
Did you handpick your team, or were you already working with a team on this and then you heard about the award?
I did not handpick my team, but this came about very organically. As we thought about ways in which we could help these patients, we realized that there is no information on what the impact of chronic GVHD is on school performance. To show you the opposite side of the coin, there is a lot of information on how chronic GVHD impacts adults in terms of going back to work. So we first wanted to understand and define the problem. But then as we thought about what our potential solutions could be, we had the benefit of our very, very strong Cincinnati Children's School Intervention Program that we partnered with, and also in terms of thinking about how we could improve education and awareness for chronic GVHD. We partnered with our Cincinnati Children's MediaLab, who we have worked with for other projects and have a good relationship with, and felt that creating, very fun, interesting, animated YouTube short or TikTok videos to educate peers would be a very cool and innovative way to reach out and educate people about chronic GVHD.
In developing this idea and this winning project, did it ever come up, or was the question ever asked as to why there was this gap in information about children and young adults with chronic GVHD when there was so much information about how it affected adults? What was the underlying reason for the gap?
That is a good question, one that I've asked myself. And as this project has continued to enroll patients, most families have thanked me for even doing this project because they felt this was an area that was never formally studied. I don't have a very good answer, but I do think that we all, as a community of pediatric transplanters, recognized that there were some impacts, but I'm glad that we are making the first step in terms of identifying the problem.
Absolutely, absolutely. Well, how did your team first hear about the award?
I heard about this award at a medical conference, actually, where it was advertised. And then the medical liaison for Incyte that I work with on another project encouraged me to apply.
Well, Doctor, with just a couple minutes left, what would you say to future applicants who are currently seeking this prize for some of their innovative ideas?
My advice is to apply to this award and seek this very unique opportunity that Incyte Ingenuity Award provides, because it's a sort of collaborative, innovative approach to benefit patients with graft versus host disease beyond just testing one specific medicine or a therapeutic agent to prevent GVHD.
And also, I think it's important to point out that you don't have to be a medical professional.
Actually, Neil, the only clarification I have is that you need to be a part of a nonprofit organization or a healthcare provider or an individual who's collaborating with either of these two. Someone
with an outstanding idea that helps a community that is suffering from, many types of disorders. Am I correct in that?
You are absolutely correct. I couldn't have said it better.
Give us a website where our listeners can learn more and possibly apply for the award as well with some of their ideas.
Yeah, listeners can learn more about this project at incyteingenuityawards.com/GVHD.
Great. Doctor, it's been a pleasure speaking with you. Thank you so much. Congratulations on your winning project, and I'm hoping to hear from you again.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Pooja Khandelwal. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.